Hello, my name is Nadeem Karimbux. I am the editor for the Journal of Dental Education. And today we're going to talk about publishing in the Journal of Dental Education. So the objectives for this short presentation are to determine which topics are of interest to the readers of the Journal of Dental Education in each of our new manuscript categories, and to give you some guidelines on thinking about how to write your manuscripts so they can be reviewed and hopefully published in the Journal of Dental Education. There are several different categories that we're looking for you to submit manuscripts to the Journal of Dental Education. One, and the major category, are articles that would fit under the topic area of original articles. We then have an area of interest that is titled under review articles. And finally, we have areas of interest that are either solicited or pre-approved by the editor. That means before you put your manuscript together, you should get in touch with me, the editor, to ask about your topic areas and see if there are areas of interest that we would like you to put together for publication. In the area of solicited or pre-approved articles are letters to the editor, and letters are simply reactions to things that have already been published in the journal. We have guest editorials. Guest editorials typically will deal with manuscripts that are being published in that month's Journal of Dental Education. For guest editorials, you can look at the journal to get an idea of the kinds of editorials that are written. We then have a perspectives area, and the perspectives can certainly include position papers or commentaries. Again, I would encourage you to get topics for these different perspectives approved or reviewed by the editor. We also are looking to develop an area on brief communications. And finally, and I think this is really an area of interest for you to consider, is an area that we're developing called the PointCounterpoint series. And at a certain point of my presentation, I will talk to you about how the position papers that you're thinking about could be converted into the PointCounterpoint series. So again, if we look at the original article area, there are several different categories that you can present in. These categories are also available on the Journal of Dental Education website under the author guideline area. So we have an area that deals with pre-doctoral dental education. For those of you that deal with graduate education, there's an area titled Advanced Dental Education. We have an area for allied dental education. We have an area that is under the title of interprofessional education. Community-based dental education is another area. Global dental education deals with not necessarily papers that are coming from overseas, but topics that deal with global health or other types of education areas that are of global interest. The next category is the use of technology in dental education. We have an area that deals with assessment in dental education. We then have two more areas, one that deals with faculty issues or faculty development, and finally, if you're thinking about submitting a review article, you should think about submitting a review article that will meet the guidelines that we expect of a systematic review. And what I've done is given you the PRISMA 2009 checklist, which is a checklist that you would use to make sure that your review article is following the kind of guideline that we would expect of a systematic review. So for example, if you look at this guideline, and I'm not going to spend a lot of time running through it, if you're writing the title should actually identify the report as a systematic review or a meta-analysis, or both. The abstract, as outlined in the PowerPoint slide, should have a structured summary. The introduction should give a rationale for the review. The objectives should be outlined. In the next PowerPoint, again, you see the protocol that you've used for the search, that you've identified the eligibility criteria, you've identified in the context of the review the information sources, you've given the search strategy that you've used, the study selection, how you collected the data, and the data items. You would identify risks of bias in individual studies, summary measures, synthesis of the results, risk of bias across the studies, and any additional analysis which were pre-specified. In the results section, we would expect you to talk about study selection and characteristics, what you found in terms of risk of bias within the studies, the results of individual studies, synthesis of the results, and again, any risk of bias and additional analysis. Typically, you'll have a flow design table that shows, again, much of your flow of how you identified the articles that you used in the review, the screening process, the eligibility of the studies, and finally those studies that met your eligibility criteria and that were included in your systematic review. So that summarizes the process we would expect if you are submitting a review article. Finally, if we think about the categories that I presented at the beginning that talk about the types of articles that we look for that are either solicited or approved by the editor, the one that I'm going to focus on is the PointCounterpoint article. So in the next few PowerPoints, I've given you the goals of the PointCounterpoint. What we would expect is a pair or group of authors to present opposing views that are supported by the literature of topics of interest in dental education. The question of interest should initially be developed by the two authors or groups. The authors or groups should also identify the individual or individuals that will present the opposing views. You can then submit the question of interest to the editor prior to writing the manuscript, and each viewpoint should be written out in a single statement. Once the topics have been approved, the authors can discuss the broad context but must write the article independently. These should be submitted to the editor for peer review. Once reviewed, the authors will get a chance to see each other's articles and to write a short one-paragraph response that will be published with the differing viewpoints. So the next few PowerPoints give you the guidelines, and I'm not going to read through those. They talk about the abstract, the article length, how the title page needs to be structured, how the abstract needs to be written, how the viewpoints or question of interest are formatted, identifying the key words for your article. The body and text are then described in terms of writing them up from viewpoint 1 and viewpoint 2. Very briefly, these would include an introduction area, background and significance, identifying the literature that supports your viewpoint. And finally, we would ask you to summarize the advantages and limitations of each viewpoint. The references would be written up much like the references that are used for a regular manuscript in the Journal of Dental Education. And then, as I mentioned, once you have written these, you would get to see them and basically have an area where you can respond to each other's viewpoints. Now, you might ask how the position paper that you've been asked to consider as a part of your leadership activity could be converted into a PointCounterpoint article. And what I've done in this PowerPoint is talk about how the viewpoints align with what you've been given as a charge for your position papers. So in red, you can see what has been taken from your position paper guidelines and have been put into the viewpoint guideline. So for example, in the position paper, you're told that it is useful to signal to your readers that your summary statement is coming with phrases such as "this article will" or "I will argue" and "my premise is." And you're asked to lay out your argument or your position. If you were to take the position that you've already identified, what you can do is follow a similar format, except ask half of your group to take an opposite viewpoint of what was being structured as a position point. In the introduction area, when you were given instructions for the position paper, you were told that a position paper takes a position or stand on a topic that is significant to the field or discipline and on which there are different opinions or even controversy. And again, all we're asking you to do is think about the different opinions or the controversy, and rather than present just one position, take two sides as a group. The background and significance is similar. In your position papers, you are asked to review the history of the issue. Similarly, with each part of the viewpoints, you would look at the literature and the history of each area. In your position paper, you're asked to address implications and summarize. Similarly, in the point-counterpoint papers, you are asked to look at the advantages, disadvantages, and limitations. You should also try to follow the best guidelines for the process. I wanted to outline for you the process for submission. Make sure that you follow from the starting point the guidelines that the journal that you're submitting your manuscript to are followed. You don't want to do your work and then have to reformat everything. There is a very nice author guideline area for the Journal of Dental Education that you can download. There's a checklist that we ask you to use when you submit your manuscripts. I'll remind you that each manuscript, despite what the editor might tell you, has to undergo the peer review process. The nice thing is that that peer review process now takes about 30 days, so you get a response very quickly. And I would encourage you, once you get your response, which could be a major revision or a minor revision, to take that list of comments that you've been given, pay attention to them, and turn your revision in. Because if you do an objective review of those revisions, you have a very good chance of your manuscript getting accepted. I've also given you all of the reviewer guidelines because I think if you appreciate what the peer reviewers are looking for, it helps you as an author avoid common mistakes. So for example, make sure that you follow the article title guidelines. Make sure that your title reflects the question that you're asking and gives the readers the kind of information that they would need to understand what your study is about. Who are the subjects? What type of study is it? Make sure your abstract is structured according to all of the guidelines. The introduction section should be, again, a section that looks at the background and significance of the literature without being a full literature review. What is pertinent to your study? Why is your study a study that is novel or is identifying new knowledge? For the materials and methods, if it's a traditional manuscript, make sure you put in all the information that would be needed so that if someone wanted to repeat the study, they would be able to take your materials and methods section and replicate that study. Again, if this is a traditional paper and not the point-counterpoint paper, make sure the results are pertinent to just that section, that you're not starting to put in discussion, that you just report on all of the results of the study. For the discussion section, again, reflect on what has been published, talk about the context of your study in the context of what has been published, and make sure the references that you're giving are contemporary references. Finally, think about your summary and conclusion. What is it that you want readers to take away from what you've reported? What are the advantages, disadvantages, and limitations? And again, the final point is to make sure that whatever manuscript you're putting together, that you very carefully follow what is being asked in terms of the reference style. Thank you very much.